Hello all, welcome to Practolytics, your healthcare partner. Here I am again with another amazing content, debridement. Before directly moving into the topic, firstly, this is Ellen Green from Coding Operations Practolytics. Here I am today to walk you through the basics of the procedure debridement. Firstly, what is a debridement? Debridement is currently the most popular technique used in the wound care. Debridement is removal of foreign material or devitalized or contaminated tissue from or adjacent to a traumatic or infected wound until surrounding healthy tissue is fully exposed. The procedure is essential for wounds that are not getting better. Usually, these wounds are trapped in the first stage of healing. When the bad tissue is removed, the wound can restart the healing process. Let's see the benefits of actually performing these wound debridements. This can help healthy tissue to grow, minimize the scarring, reduce complications of infections. If not debrided, it delays a wound's normal healing process. Mimic or hide infections, attract bacteria to wound, increasing the risk of infection, increasing the odor and exudate. And when is this debridement procedure actually necessary? Debridement is not required for all the kinds of wounds. Typically, it is used for old wounds that are not healing properly. It is also used for chronic wounds that are infected and getting worse. Debridement is also necessary if you are at risk for developing problems from wound infections. In some cases, new and severe wounds may also require debridement at some point on time. Let's see the selection criteria about this. The best type of debridement depends upon your wound type, current age, overall health, risk for complications. There are many types of debridements: mechanical debridement, enzymatic debridement, biological debridement. The type of the debridement is dependent upon the selection criteria again. Debridement is usually performed when there is arterial insufficiency ulcers, including diabetic lower extremity ulcers, dehiscent wounds, wounds with exposed hardware or bone, neuropathic ulcers, neuroischemic ulcers, diabetic foot ulcers, complications of surgically created or traumatic wounds where it accelerated the granulation therapy is required, which usually cannot be achieved by any other available topical wound treatment. At that point of time, usually providers would recommend going for a debridement. I hope this helped you in understanding the basics of debridement, like what exactly a debridement procedure is, when it is performed, and all. We will be back soon with another amazing video on the CPT guidelines and the CPT codes that are to be used in the debridement technique. Thank you so much for your time.